It will seem that the federal government of Nigeria is addressing the Jackpot syndrome in the health sector. The government has launched a new healthcare policy that is aimed at transforming the country's healthcare system and addressing the severe shortage of health workers. According to Nigeria's Coordinating Minister of Health and Social Welfare, Mohammed Pate, key aspects of the policy include regular reviews of working conditions, emphasis on digital health infrastructure, capacity building through continuous professional development, and simplified registration processes to encourage the return of Nigerian health professionals from abroad.
The policy comes as Nigeria faces a critical shortage of doctors and health workers, with only 55,000 licensed doctors serving a population of over 200 million people.
Joining us is the National Vice President, Nigerian Medical Association, Dr. Benjamin Olowo-Jebutu. Thank you so much for joining us.
Thank you for having me, Olive. How are you today?
I'm very well. And how are you? I should ask you, are you excited by this? Is this guru? Is this something that the Nigerian Medical Association is thrilled to hear?
Finally, I think they're listening to us now. But it's not just writing the papers now, it's now implementing them to be sure that is a true reflection of what government really wants to do. Because, you know, in this country, we like to pay lip services, we like to talk. And for me, it's about maybe like verbosity. We just talk it about how do we now do it. It's very important. There are no timelines to it. We don't say, they've not said this is the timeline for implementation. How are you going to coordinate with local government, with state government? Because most times when you drive visions from the point of federal government, it doesn't cascade down to both other killers of government, basically. So, but it looks good because I read the policies over the night because I was coming here today.
Ah, brilliant.
56 pages. Looks like it was detailed work. Looks like it was researched. But we've not talked about implementation, accountability. Who are those that would do this? Who are those that would do this part of it? Who is responsible for the research? Who is responsible for the working conditions? Who is responsible for the mentorship? So those things are very, very important going forward to ensure who to ask questions from. You know,
what are some of the things that will genuinely reduce the interest of Nigerians and Nigerian doctors, Nigerian healthcare workers living in the country? What are some of the details that you've seen in this proposal now that, you know, if they truly implement, any doctor who's, you know, currently in Ibadan, planning to go to Canada next year is going to say, now stay back.
So I saw the part that says constant review of remuneration. That sounds very good, because one of the basic things that have discouraged doctors to stay back in this country is the kind of work we do and the kind of remuneration we get as per the kind of work we do. So WHO says one doctor to 600 patients. Or in Nigeria, we have one doctor to 10,000 patients. That's amazing. So you have doctors dying. You have doctors overburdened, work stress is there. Somebody has hypertension, has kidney disease, not lost the kidneys. 7 people, So if the working conditions are improved on, and the younger doctors, you coordinate their working hours. I give very small advice. I said a few weeks ago, I was talking to some of the CEOs. I said, if, for example, before you should have 10,000 people in a clinic that was run by 10 doctors every day, and the doctors are reduced to 5 doctors, what you should do as a CEO is to tell the patient or the public that, sorry, we can't do 10,000 patients again because we now have 5 doctors. Let's reduce to 5,000, and you cascade out the come to the clinic. But you know what they still do in the hospitals? They still maintain the 10,000 patients to be seen by these 5 doctors.
Yeah.
So there's overburden, people fall ill, there's no proper infrastructure to support what they're doing. And you don't feel encouraged. So you are tired every day going to work, you are tired, you're not enthusiastic to see the patient.
Is this more in the private health sector, the private spaces?
No, everywhere. It's everywhere. It's even more in the public sector.
Right.
Because the private sector usually attracts doctors by remuneration and says, okay, come, we'll pay you more, we'll give you accommodation, you can stay in the hospital, that they make it more attractive. But if there's a benchmark of remuneration and says, this is what you will get. You get a car loan, 1-digit loan to get a facility support for your hospital or for your career. You get house loan. You get your children go to proper school. There's a rebate on their school fees. You can go out at night. the security is checked. You don't get maimed.
Yeah.
Let me give you a scenario, my brother. A doctor in a boy had done multiple CS over the night because there was emergency. Hardworking guy, passionate, but died in the morning. Yes, he didn't wake up. So he worked hard. And how do you incentivize doctors that have died in active service? What happens to their family?
Do we have some form of life, insurance for them?
No, we don't.
Okay.
But I want to also ask, this bill we're talking about now, we're talking, just doctors or, healthcare workers?
Healthcare workers generally, but I speak for
nurses,
doctors, lab scientists, everything. But the ministry covers everybody. I don't speak for doctors because I know where they should, I know where they should ought us, and obviously everybody is affected. The amount of nurses that live in the country to the UK because of their aging population, and obviously they don't like to do medicine in those places because they like fintechs, they like technology. So they poach our people because we're ready to move, same environment, more money, more avenue to improve your skills and use what you know to affect people. A lot of doctors live in Nigeria to go and study abroad with their own personal resources, and when they come back home, the tools to work are not available. So I like the fact about it says the continuous professional education. That means government will be sponsoring talent and says, okay, go study this part of medicine abroad and come back and deliver to our citizens. So it makes a lot of sense.
Seeing as you speak for doctors, give us a picture of what the current reality is. When you say, because we've been talking about the salaries and the remuneration of doctors, how bad is it?
Very bad. So before subsidy, doctors that earn $1,000, he makes money. You've made money. But now that there's a lot of inflation, the $1,000 is like making nothing. I think the enabling environment is not enabling enough for people to try. Doctors have, somebody sent me a message yesterday and says he's frustrated. He doesn't even know why he's a doctor. He can't even read books anymore. That he has a young wife. He can't feed the wife properly. Medical doctor, young doctor. I was pained. Okay, so if he says to you, he says leave in the country, I don't have any justification to say don't go. But the reason why we have stayed back because we believe that we have a role to play in shaping the face of the healthcare, and we cannot stop talking about it. One day the government will hear. You've heard this one. I'm glad that they're thinking about it holistically. That what affects the doctors, not just remuneration, working hours, job satisfaction, security, improved knowledge, improved seeking more advanced knowledge outside the country and be able to come back. And those that are outside the country having seamless able to come back to the country and help the country. But one thing must also do is that the climate and the working condition in this country must be changed. It must be changed. People must feel good to go to work every morning. And say, okay, and I like the fact they talked about this rural allowance. So we have two kinds of japa in this country.
Yeah.
There's a rural to urban japa. There's a urban outside japa. So people leave, as I said, leave the rural communities and come into Lagos,
cities, yes.
Come to the city, make a lot of money for a few months, save, do exams, and leave. So if we now incentivize and say, okay, if you stay in a rural community, you are the doctor affecting this people. Let's pay you some kind of allowance to stay there. Let's support what you do. Give you infrastructural benefit, support your system, support your hospital, give you medications, give you, I believe the government is already talking about having local production of drugs, generics, that we're not just waiting on importing all the drugs, they're increasing duties for it and making it expensive. Because now, if somebody that's hypertensive that is taking drugs before, every month, maybe for 5,000 naira, every month as the drug for monthly, is not 25,000 naira.
Even 40.
Even 40.
Yeah.
That's for the patient.
Yeah.
So it's important, it's holistic. So as we are addressing healthcare, professionals, you are addressing the system that makes the environment awesome for patients also to seek healthcare.
Yeah, I think it's also important to mention, that the Jackpot syndrome is not just affecting doctors. It's people from everywhere.
Yes.
And also, it's not simply because of poor pay. It's a general feel about Nigeria, where Nigeria is and where Nigeria is going.
Yes.
For a lot of people, an increase in salary wouldn't, solve that problem. But I also want to ask, the NMA has had its back and forth with the Nigerian government multiple times.
Yes.
Failed promises, new agreements are signed, NMA threatened strike again a couple of months later. What do you think is going to be different this time?
So we have a very, very focused president now, Professor Balaudu. He's a technocrat, an administrator. I think he understands the language of negotiating, back and forth, be able to. So what the thing I realize about government now is that when you negotiate, you must give a very superior argument that is realistic, that is seeable, that is, you can see it, that if you don't do this, I give you a very small scenario. You want to increase the IGR of a hospital. You have 10 urologists that does amazing surgeries, and one of them give you an income of 10 million naira a month. That is 10 will give you 10 million naira. If you lose 5 of them, you lose 5 million. So what will make you keep them is tell them, increase capacity. What do you need to make the work better for you? Who are they accountable to? So for me, it's not only money, not only salaries.
Yep.
The working condition, the instruments to work, the attitude of work,
Right.
the love of the country. Health is a right. You get my point? So the country must show leadership. Government must show that we want to solve this problem truthfully, not lip service.
Yeah, that's what I'm asking. Why do you trust them? Because we still 2024's budget, for healthcare is not very different from 2023.
I didn't say we trust them. I said government must make us trust them.
Okay.
Because we've lost trust in government for a long time. Can I give a very small story? So, commerce salary was increased last year. From January till now, we've not gotten the commerce areas. Doctors, now there's now increase in minimum wage. So there will not be consequential adjustment again. Now we are waiting for when that will happen again. So when you say you've promised this salary package for doctors, for healthcare workers, just do it. There's no point promising. I'm not going to do it.
Are there any other things that they can maybe mimic or policies they can adopt from other countries?
It's simple. When our senior colleagues, when I finished medicine, back in the days, in the late 70s, early 80s, very, 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 very close to 90s, as you finish medical school, you have a flat waiting for you, one of the low-cost housing estates, and a small car. With that one, you already feel good as a doctor that all this my stress I went through medical school, this is my reading multiple books, big books, it didn't go in vain. That means I am appreciated. What is making a lot of doctors feel pain is that we don't feel appreciated in this country. Can I shock you? A doctor has been kidnapped in Kaduna for the past 3 months. We've not found her. Nobody's talking about it. A doctor was maimed in Enugu going to work. No government even says sorry to the families. So they failed us. So what makes you feel good going to work that you think you can be kidnapped, or you can be kidnapped on the road, or you can be maimed?
I mean, these are such sad stories that you've talked about, but the current reality that we're facing in Nigeria as Nigerians is that for a while we'll have to have a number of these challenges. So this policy, is it enough to cause the impact that the government is expecting?
When is the policy starting? First question.
Valid question.
Who is accountable for the policies? What are the cadres? What are the timelines? Excellent policies. In Nigeria, we like to write books. It's very good. But how do we implement them? My joy before was that local government now has autonomy. Yeah?
Yeah.
Says you have, but are we sure that they understand what autonomy means? The local government people. Which means we have 774 local governments in this country.
Yeah.
And they are responsible for the primary health care centers in the country. So who will now tell them what they need to do in primary healthcare centers? Who are they accountable to? All they wanted was autonomy, but who are they answerable to? The governors or the federal government? We don't know.
They know their responsibility.
They know their responsibilities.
And again, so these things, like you've said, it's interesting on paper, but if we don't see that there's a change in what our annual budget is for health, then these things aren't really achievable.
Correct.
Because they need to invest more in healthcare. The things that you're complaining about, the equipment for work, your working conditions, of course, and this is public and private hospitals as well. If you don't see that there's now better funding, then this is all just talk.
Right.
So you now have younger colleagues in secondary schools asking them about mentorship. I'm sure you read about the Prime Minister of England begging the teens to come and do medicine because people don't want to do medicine anymore.
Yeah.
Hopefully, we pray it doesn't go to extinction because now there is no mentorship. Nobody sees who they want to be like anymore.
Right.
Because it's not what they want to just see.
It's no longer what it used to be.
Growing up, when they ask young people, what do you want to be? I want to be a doctor.
I remember that. I'm a doctor in my country. I sang that somewhere wrong. But now I don't know.
Everybody knows me well.
I think it's a good opportunity to once again remind the Lagos State government of the doctor who died in the elevator.
Yes, I was about to ask if anything was Dr. Viri. Yes.
We've asked, I was chairman of NMA at that time before I became manager. So we've asked them, one, they need to obviously immortalize her, name that being after her. They're doing a lot. They're doing some innovation in the place right now. But it's beyond that. It's about having an emergency response properly, documented. Having people be able to know what they need to do when there's a problem like this. Who are accountable? Do we know those that caused the challenges before? Have they been prosecuted? What are their names? Have we named them? Do we know them?
And can we ensure that this will not happen again?
Yes.
I mean, these are the conversations.
Those are the things we need to talk about. So it's not just writing stuff. I'm just saying a lot of stories about who is accountable to the people. Last thing, please. We must show love. One of the things we've lacked in this country as government is no love. Love is the only thing that will show that you can't sleep on two beds at the same time. And you must see your next neighbor as yourself. So if you're going to provide healthcare, provide healthcare. If you won't, don't. Because you know that if you have a headache, you take taxpayers' money and travel abroad.
Anyway, this is really conversations that we can't exhaust today, Dr. Benjamin.